Today, we have a special guest, Spencer Block from eXp Agent Healthcare.
Hey everyone, how are y'all doing?
Fantastic. When we have, alongside Spencer, we have Jeffrey DeJesus, a real estate agent, a top producer in San Francisco, California. And today we are going deep dive into what eXp Agent Healthcare is and what benefits it offers. So let's get started. Jeffrey, I'll let you start off with the first question.
Great. Hey, so Spence, what is eXp Agent Healthcare?
Yeah, it's a great question. First, thanks for having me on. I'm excited to talk about benefits and how we can help agents. Mm-hmm. And eXp Agent Healthcare is part of eXp Solution. And bottom line is we just want to help agents find the best plan at the best price. And we do that through a number of ways. Our most important way is that we have underwritten plans that were written specifically for the independent contractor, the real estate agent, because beforehand, all they really had was plans that are on the exchange. But now They have access to these really well thought out plans that are saving agents around $8,000 a year when they switch.
Wow.
They're usually able to access a much better nationwide PPO network. And they're getting a really strong plan at a really good price that fits their budget.
Oh, well, that's great, Spence. I'm a living testimony of it because when I met you 3 years ago, we started at a plan at Kaiser at around $1,300 a month, and you guys were able to get it down to $800 a month, and we added one person. So, I mean, right there, we saved $500, and I guess you could probably say my 20-year-old daughter is free. So,
yeah, we see those savings all the time, and a lot of times, what a lot of agents are also saving on are those big out-of-pocket expenses. Right now, the average maximum out-of-pocket across the country is around $8,000+, and on most of our plans, the highest maximum out-of-pocket is around $5,000, and our most popular plan, the actual maximum is $2,500. So there's huge savings right there.
I mean, that is amazing. I mean, a lot of 20-year-old, 30-year-old, 40-year-old really don't think of healthcare. But when you start getting my age, 50 years and older, this is a very important topic. And, if you got precondition, which I do, and, I was able to save quite a bit of money. And with that savings, we even increased our life insurance. So that's a great thing. That's what we did in my household since Spence saved us $6,000 plus a year. We were able to put that into more life insurance. But anyways, I have another question here. Why should an agent consider eXp Agent Healthcare plans versus other healthcare plans?
Yeah, that's a great question. And as I mentioned earlier, it is the difference in costs, especially between your monthly costs, your deductibles, and your out-of-pocket expenses. And that's really where they can save. Also, the big thing is that we do have a nationwide PPO network. So a lot of these plans, it's pretty much limited to your state, and a lot of times it's just limited to your city. So if something happens to you when you're traveling, God forbid, it's going to really hurt yourself when you can't go to that, when you go to that ER and that ER is out of network. And now all of a sudden you're looking at a very, very expensive bill that unfortunately most people just don't have the funds to provide. It's around 60%, probably a little bit over now, of bankruptcies, personal bankruptcies are actually medical debt. And
Definitely.
That's something that Clearwater, that our founder wanted to address, is that he saw that there was a problem and a need for plans that can help people not fall into that hole, because it's awful and something's just got to be done about it.
Like I said, this is a very important topic as you get older. People right when they hit 40, they say your eyes go bad. Here comes the prediabetes. Here comes the high cholesterol. It all comes tumbling down after 40. But fortunately, you guys are here to help navigate us through this very complex matters and issues. But
I have a
hey,
question.
Yeah, go for
Yeah.
it.
So how are you guys able to offer such competitive pricing?
Yeah. So our most pop, so we have numerous plan options that people can choose from. We have plans that are suited for people that I never want to go just in case of a worst case scenario. Plans that are I have to see the doctor once a month for XYZ condition. Our most popular suite of plans, one of the biggest reasons why the prices are so low is that people 65 or older cannot enroll.
Mm.
And that drives the cost down significantly. And also, if you are 65 or older, you should hop on Medicare anyway. We wouldn't be doing that person justice by having them come onto our plans because if you qualify for Medicare, go ahead and do that. But what's great is, eXp Agent Healthcare, you can kind of just imagine it as eXp's like benefit departments. So we can help you enroll into Medicare if you need it, and also to help people with those Medicare supplementals as well. So that's your Medicare C, and so that's everything on top of Medicare A and B. So that's your C and D or any Medigap policies. We do have some consultants that are pretty good experts in that and can help someone navigate that path because it gets really confusing. And that's also what I love about this partnership is the consultation process. The fact that someone has a person that they can have a conversation with, go over what needs they want their plan to address, have their plans explained. Because before Clearwater, I went into the marketplace, turned 26, was working for a startup, and essentially my CEO said, okay, here's $250. That's what I'll pay for your plan. That's your stipend. I found a plan that was like $245. So I was like, okay, that's it. Had no idea what it was. Thankfully, nothing happened to me while I was on that plan, because if something did, I would have been out around $7,000.
That's quite a bit of money. And, I'm really glad. So what can an agent expect from a consultation call with you?
Yeah, it's that white glove approach. It's someone that truly just has your best interest at heart. They will recommend the best plan at the best price. Most of the time, it is one of the eXp Agent Healthcare plans, but if it's not, they will still recommend that plan as one that you should go with. They will help you enroll in that plan. And we also get a lot of comparison plans. And a few times it does happen where, given the person's needs and all the variables considered, our consultants will say, you know what, you're on the right plan. Congratulations, just stick with that. Okay. And I think that speaks a lot to our character, that we're willing to not go for the sale if it's not in a person's best interest.
That's wonderful. That's really good to know, because a lot of people who's going to be watching this video or watching now needs to know this. I mean, I could see my wife, who handles this and talks with you regularly, Spencer. She's on the phone for hours and hours at a time in the beginning, but now you gave her the right path. So we're pretty much good to go right now. So
she's an expert now.
Yeah. I mean, there's a few things in life as you get older that you start worrying about. You start worrying about healthcare, retirement, life insurance, and taxes. So, we have to button down, even though we make a good amount of income every year. It is very wise to save where we can. But and this is really big.
Yeah, and even if you're young, nothing's really going on. It's kind of like, health insurance can also be kind of similar to life insurance, in the sense that you don't really want to get on a life insurance plan towards the latter years of your life. Right. It's sort of the same thing with health insurance. If you get on a plan early when there's nothing really going on, life is just going to come at you. Right. We're all going to have, whether it's an injury or we get an illness. And if you do get on a plan early when nothing's going on, you're really not, especially with our plans, you're really not going to you're not going to incur as much financial hurt, right, as if you go in when you already have something. And luckily, we have plans that are just perfect for people that just need something in a worst case scenario that's not going. So you are really getting what you pay for. There's a lot of people that say, oh, I pay so much for my plan, and even when I get sick, I still have to pay a lot of money. Like, what the heck is going on? So we have plans where you're actually getting a good bang for your buck.
That's very, very, very good. Justin, do you have any questions here? I have some more questions that I want to get into.
Go ahead.
Okay, great. So, what are some examples of eXp Agent Healthcare helping agents with their needs?
Yes, there's a lot of, I mean, obviously, feel for the person because they went through something pretty horrific, major illnesses or injuries. So we never wish that upon anyone, but that's why the plans are there to at least get them the care that they need, and they don't have to worry about, man, how much do I have to dip into my savings? We had one eXp agent, and he's spoken a lot about it. He had a very serious case of COVID, was in the ICU for about 2 weeks. ICUs and hospital stays, that's one of the most expensive part of your bill. It can go, one night could be $10,000. It's absolutely insane. When he fully recovered from COVID, and when he was discharged, that bill was around 1.2 million.
My.
Yeah.
Wow.
It's expensive. He only had to pay $1,000.
Wow.
Okay.
I mean,
Wow.
why is it so expensive? Why is this 1.2 million? What did they
So
charge?
you go to, I mean, it's everything. Have you know, like ER, those medical shows, ER, Grey's Anatomy, and someone comes in and the doctor just starts saying, I want this test, those tests are expensive. And the doctor is, they're having to pay, the hospital's having to pay the doctor and all the nurses and the rent. And so it all just adds up. And when you spend the night in the hospital, they're usually pumping fluid. All that medicine, that IV bag is not free.
Yeah.
The needles they use are not free. If they have to bring in a specialist,
Wow,
that's not free. If they have to hook you up to some kind of machine, that's not free. And it all just adds up. And I don't want to get too into then the weeds of network contracts and all the different components that are running behind the scenes, but that's probably the biggest reason why ERs and hospitals can be one of the reasons why ERs and hospitals can be very expensive is
crazy.
There's just everything that a doctor does or a nurse does that's being added to your bill.
Well, could you imagine 1.2 million after a few months of stay in the ER? You just come out feeling all good,
and then here you go, sir.
Yeah. And like what Spence said earlier, 60% of BKs are from medical matters. And so I mean, when my mom and dad passed away, they left a good stack of medical bills there. And it wasn't fun for the family, put it that way. So how can someone learn more, Spence? I mean, this is a very great conversation, but how can someone just get more information?
Yeah. So expagenthealthcare.com, that's going to be probably the best route to go. That's going to have all of our plans that you can look into and read about. It has our quote tool, takes about 1 minute at the most. It asks very simple questions and it will recommend a couple plans for you. But most importantly, it has that book a call link. You click it, a calendar is going to pop up. Choose the time and the date that you want. The calendar will adjust to your time zone. And you pick the time and the date that you want, and you're paired with your consultant.
A few more things before we end this video, but how about if someone has a team or a staff member that's on a W-2? Are they covered? Can they get a plan?
Yes, they can most definitely get a plan. Depending on what that person wants, the employer wants, there's different routes that we can recommend. We do have a team of group plan specialists that can walk them through that process. So they will be able to get access to those plans and then being helped out with all of the nitty-gritty tax forms and stuff that you have to send to the IRS and Department of Labor as a business owner.
Here is a bonus for eXp agents. So here's a question. How can someone use eXp Agent Healthcare for agent attraction and retention?
Amazing question. It's just a great talking point to tell someone that you have a dedicated team of people that help real estate agents with benefits. Just saying that alone is a huge help. We have an agent attraction toolkit with social media posts. video testimonies that people can use to help grow their team. As far as retention, and our consultation team has talked to a lot of people that have another job, and real estate's more of a side hobby that they really want to get into. But obviously they are worried about, well, if I leave my job, I'm not going to be able to pursue real estate full time. And sometimes they might go back to that full time job. So when they're able to talk to our benefit consultants, and they're able to see, oh, wow, it's not nearly as expensive as I thought. And I'm actually not even downgrading my actual benefits. So I can go into this real estate full time because I'm going to be making a ton of money. Because when you join eXp, the amount of people I talk to that join eXp and the success they have is unparalleled. And by being able to focus full time is pretty amazing. But I'll tell you a real quick story about how this can help someone. Because quick backstory is I worked in China for 2 years as a translator. When I moved back to the States, a ton of real estate agents were messaging me on LinkedIn wanting me to work with them just because the real estate investment from China in US real estate is huge. So there's a lot of opportunity there. Miami, I know I'm saying that a Miami Keller Williams broker did reach out to me, and I was like, well, Miami's pretty cool. So I went down there and it was awesome. I mean, South Beach is amazing. And, this broker was very successful, pulling out all the stops. So it was really cool. But when I asked her, hey, I'm turning 26 in a couple of years, like, what do? I know like Keller Williams doesn't have like a health insurance plan or anything like that. Like, but what, like, can you help me out? And she was like, no, not really. You're on your own. And that was it for me. I was like, you know what? I don't want to risk it. I'm just going to go get a job that has health insurance.
Right.
And, had she said, yes, we have these plans, and you'll be teamed with a benefit consultant and they can work with you. Who knows? I probably would have joined, and who knows what would have happened. So the fact that eXp can say when they're attracting someone, they can say, and someone brings up that inevitable question of, well, what about benefits? And they can say, actually, we have a whole eXp solutions team that's just for agent benefits. Who knows? Yeah. That could change someone's life.
Yeah, well, for sure. I mean, it is a very important question for agents to have healthcare. And I think what is the percentage of agents that don't have health insurance? Do you know?
About 30%.
Wow. See, 30%. Imagine that. And you make it so affordable. And I'm sure when you're around 20 or 30 years old, people get insurance for $100 a month, possibly, right?
I think our lowest price plan, if you wanted the lowest price plan, I think it's around 180.
Wow.
That's not bad.
Well, wasn't that amazing? Healthcare at an affordable price for real estate agents within eXp. If you have any questions, make sure to leave a comment down below. Reach out to us. Reach out to Spencer. His information will be down below. And as always, thank you, Spencer, for joining us today and sharing your knowledge of eXp Healthcare with the audience and us. And thank you.
You're very welcome. Thanks for having me.
Thank you, Jeffrey, for being the host on this video and asking all the important questions that we need to know as eXp agents. Do you guys have anything to add before we close out this call?
Thank you, Spencer, and thank you, Justin. I hope this video reaches the right people and, answer a lot of questions. Just continue to watch it a second time.
Yeah, thank you all so much.
All right. Thank you, guys. I'll see you next time.
All right. Bye.